Today we're telling you the truth about how long orthodontic treatment should take, and it's not what you think. I'm Dr. Sean Carlson here at Simple Orthodontics in Larkspur, California, and today I want to take you through why there is so much confusion about orthodontic treatment times. Now, here's the controversial statement about orthodontic treatment times. Most often, it takes longer than it should. The average orthodontic treatment in the United States is 26 months. That is far longer than is necessary. Most orthodontics is incredibly inefficient and you are in braces too long. And I explain in a lot of my other videos why technology can really reduce your treatment time if you are going to an orthodontist that uses technology in smart ways. Now, I've been treating orthodontic patients for over 25 years, and our average treatment time was between 14 and 16 months over the course of those 2 decades. And we're finding now with the technology that I'm currently using, that treatment time average is getting shorter. So if you've been in braces for 2 years, 3 years, it is taking too long. Something is off track and you need to talk to your orthodontist about it. Now, every once in a while, things can happen where orthodontic treatment gets a little bit derailed, but it should be spotted early by your orthodontist, and they should know inside of the first 6 months if surprises are going to happen. So make sure you're getting good communication from your orthodontist, and that will help you stay on track and keep your treatment time on track. Now, if your orthodontist has quoted a treatment time for you, make sure that you check in about that at each visit. Here at Simple Orthodontics, we use remote monitoring, which means we keep an eye on our patients every week with an at-home scan. That digital scan gets sent to us, which means we can follow progress of orthodontics on a weekly basis. That means we know immediately if treatment is getting off track or getting behind or running ahead of schedule. Our goal is always to finish orthodontic patients efficiently. So if we can do it ahead of schedule, we always like to do that. Now, there's typically 2 types of orthodontic treatment that we do here at Simple Orthodontics, generally on children populations, and that's what's called phase 1 orthodontics. We have another video about that. Phase 1 orthodontics is often called interceptive or preventive orthodontics. And then there's phase 2 or teenage orthodontics, which is done on adult teeth, and that's something that is often done in the teenage years. For us here at Simple Orthodontics, phase 1 treatment usually takes between 8 and 12 months. So usually we can get treatment done on the foundation, get things set back to normal inside of a year. And typically phase 1 treatment should not take a lot longer than that. Sometimes there are very complex growth issues with the lower jaw that might make that treatment last longer, but those types of situations are rare, and certainly we communicate with our families about those if your child has one of those problems. Now, for comprehensive orthodontics done on teenagers, usually an average treatment time is also under a year. So if you've had a foundation set up with early intervention, alignment of the teeth on that foundation usually should take place inside of a year. And technology is allowing us to do that here at Simple Orthodontics very predictably, very efficiently. If you haven't had early intervention and we need to prepare the foundation before we do the alignment of the teeth, sometimes that will add 6 months to the beginning of the treatment. But usually we try to do that with partial appliances, so the braces themselves are rarely on for more than a year. We happen to do a lot of treatment with aligners here at Simple Orthodontics, and usually our alignment treatment for teenagers is done inside of a year. And oftentimes we are beating our treatment estimates because technology is just getting so good and so predictable at moving teeth. So be sure you ask your orthodontist about treatment timing. And if your orthodontist is quoting timelines of 24 to 36 months, really question what's getting done during that time. And if the braces themselves are on for more than 16 or 18 months, something is going off track. So check in with your orthodontist and find out why this is taking so long. Now, one of the benefits of technology here at Simple Orthodontics is I'm finding orthodontic alignment using custom appliances, which is what we use, custom braces only on every patient. Our treatment time with braces is getting extremely short because technology is taking out a lot of adjustment time. It is the same with aligner treatment. We're able to treatment plan using three-dimensional imaging and root movement prediction technology that is making our tooth alignment very efficient. So check in with your orthodontist, make sure they are using the latest in technology, make sure they are using remote monitoring to follow your treatment every week. That will ensure that you stay on track. If they're not doing those things, you may want to interview a few other orthodontists. Here at Simple Orthodontics, we're always open to answering questions. Feel free to reach out to us. If you have any questions about your treatment, we'll be happy to get those questions answered. Follow us here on YouTube, Instagram, and Facebook for more videos like this. Until next time, be well and smile more.